Imagine giving cancer a blinking beacon so doctors can find it anywhere in the body. That's the basic idea behind a PSMA PET scan. PSMA stands for prostate-specific membrane antigen, a protein that is often abundant on prostate cancer cells. In a PSMA PET, a tiny radioactive tracer that binds to PSMA is injected into the bloodstream. The PET camera then lights up areas where the tracer concentrates, revealing even very small prostate cancer deposits that other scans may miss. How is it different from MRI or CT? MRI shows structure, the shape and anatomy of the prostate and surrounding tissues, while PSMA PET shows biology, the molecular activity of cancer cells. That means PSMA PET can detect tiny metastases in lymph nodes or bone earlier and more accurately than conventional imaging. This makes it especially useful when PSA is rising after treatment or when staging higher-risk disease. When should you consider a PSMA PET? The common scenarios are a rising PSA after prostatectomy or radiation to find the site of recurrence, initial staging for certain high-risk patients, or to guide targeted therapies such as metastasis-directed treatment or PSMA-targeted radioligand therapy. It isn't needed for every patient with a mildly elevated PSA. Clinical context matters. What to expect? The test involves a short injection, a waiting period while the tracer circulates, and then a PT-CT or PT-MRI scan. It's non-invasive and generally well-tolerated. Results typically inform more precise treatment choices, potentially sparing people from unnecessary systemic therapy or enabling targeted cures. Practical tips. If your PSA rises after prior therapy, ask your urologist whether PSMA PET is appropriate. Request that results be reviewed in a multidisciplinary tumor board. And remember that a negative scan doesn't always rule out microscopic disease. Knowledge from PSMA PET can change management, but only when used in the right clinical setting.